if it feels like there's a lot of paperwork, a lot of hoops, you're not just seeing someone for 15 minutes and sort of being told, yep, think you've got ADHD, let's start some medication. I hear you. It's grueling and cruel, and when we're coming for struggles with focus, to be made to do all that is so ironically hard, but it's actually a good sign.
It can feel a little bit like hurdle upon hurdle, and the waiting time can be tough. Like, it can just take a little bit of energy. I had to fill out a lot of paperwork.
Yeah. I get patients saying, is this a weird test for
I thought it was a
if
test.
you can finish the questionnaires, do you not have ADHD? I get that all the time.
Today is an episode with the wonderful psychiatrist, Dr. Kieran Kennedy, who joined us on a previous episode where we spoke about ADHD diagnosis, how that impacts your sense of self, your identity, and how it can also kind of cross over with other conditions like depression, anxiety, the common symptoms. But he is back with us today to speak about the current theories of what causes ADHD, whether that be biological or environmental, how much of it is genetic. We're going to talk about medication options, whether that's a path that you may want to go down, or if you just want to get a bit more education on what the options could be should you want to go down that route. We're going to talk about some of the criticisms of medications, some of the concerns, some of the side effects. We're also going to talk about how to actually get diagnosed. It is something that a lot of people find quite confusing. They don't know whether the chicken comes before the egg. They don't know what steps to take and in what order to do them. Dr. Kieran Kennedy, welcome back to Cloud.
Nice to be back. Thanks for having me once again.
I've read a few things about the potential causes of ADHD, and some things that I've read say that it's almost completely biological. Other things say that it's environmental. Some say that it's a crossover of the two. Some things say that it's, a disorder of metabolism. Some things say that it's a disorder of neurotransmitters. It's all a little bit confusing. What is the current medical understanding of what the cause of ADHD is?
It's a spicy one.
The neurospice is real.
If I could rattle this off really simply and concretely, I would be winning a Nobel Prize probably. The hopefully slightly equally reassuring and maybe slightly confusing, frustrating thing is for ADHD, as well as a lot of our neurodevelopmental and mental health conditions, the straight answer is we don't quite know yet definitively, but there are a lot of theories and we have a lot of knowledge about what might be involved when it comes to what causes ADHD. So I think particularly for neurodevelopmental disorders, we know that there's definitely a genetic element here, and we know that there is something in the biology of the brain, the neurochemistry, and the way the brain develops in terms of what is sort of leading to some of the symptoms that we then feel and see and experience. And I guess in essence, a neurodevelopmental condition, ADHD, autism, other conditions, the leading theory here is that this is something within the brain in terms of its development around certain areas of the brain, pathways within the brain, how those areas connect, the balance of neurochemicals and transmitters. I'm trying not to put you guys to sleep here. The biology and the genetics here is around factors with the brain in terms of the connection between different areas that manage focus, that manage our attention, that manage our orientation towards tasks and actioning tasks. These are areas of the brain felt to be involved, and we have a lot of research showing that there are some differences in regions of the brain and how those regions communicate for people with ADHD versus people who might not struggle with the same symptoms or have ADHD. There's also evidence and a lot of biology around potential, as you mentioned before, for neurotransmitters or chemicals that our brain cells use to communicate and pass messages between each other. There's a lot of theory and evidence around the levels of those chemicals, and dopamine and noradrenaline or norepinephrine, which we'll get into. These are two of the main kind of neurochemicals or transmitters that are felt to be involved. Interesting, I think, to point out as well that ADHD is quite a genetic condition. And so we know compared to a lot of other mental health conditions, for example, ADHD actually has one of the highest levels of genetic linkage within families, showing that there is likely or very likely some level of kind of genetics biology going on here. So sort of there's heritability or genetic links for ADHD of sort of even above 60%. And if you have a first degree relative with ADHD, and again, the stats here vary depending on where you look, but you're 9 times more likely to have ADHD if you have a first degree relative or family member who has ADHD compared to someone who does not have a family member with ADHD. So, whatever the level is, and obviously it's very complicated and complex, but there is some level of our genetics and our biology and things influencing here for sure.
Mum, if you are listening, it's you, okay? Of the two options that I have, I know that it's you. You need to go to the psychiatrist. Kieran, I've seen a little bit of discussion about the prefrontal cortex, something to do with blood flow in the prefrontal cortex. Can you explain for us what those are and how they may impact ADHD?
Absolutely. And, like talking about cortexes and frontal lobes and things gets my neuro geek juices flowing. The prefrontal cortex is really a lot around our sort of the frontal lobe of our brain and our prefrontal cortex. We talk about executive functions. And so the prefrontal cortex in particular is involved in elements of kind of impulse control. It's moderating our decision-making processes, our higher order functions in terms of planning, organizing, executing tasks. We know that the frontal lobe and things is also involved in elements of our personality in terms of some of those major features that kind of separate us all out on different ends of the spectrum. So the prefrontal cortex in particular is an area alongside other areas within the brain where there's a lot of research still going on, but also to already show that there might be some even subtle differences in blood flow or levels of dopamine and noradrenaline, and how that balance in terms of the prefrontal cortex talking to other areas of the brain to moderate emotions, to moderate impulses, planning, memory, all of these different things. It's a really good example of an area of the brain that's potentially quite heavily involved here with ADHD symptoms.
I think when it comes to the debates about what causes ADHD, particularly when it comes to whether this is a completely biological thing or whether it's environmental, something that I experienced myself, finding out that there was likely a genetic cause to it, I feel as though it alleviated a little bit of the blame for me, of the sense that I was like, oh, maybe I didn't cause this to myself. Maybe it wasn't, screen time. Maybe it wasn't some food that I ate. Maybe it wasn't my parents' fault for what they got me into swim practice. Like do you know what I mean? I think that there's this kind of seesaw between blame and brain of, well, there was nothing I could do about this. Is that something that you seem to find a lot in the practice? Like, what is people's general reception to finding out that it likely could be a biological cause? And do you have people who push back on that?
That's a really, really good question. I don't often have people that push back on that, actually, and I think it's really, really important, at least for me and how I like to practice, to not push too far either way. I think mental health and conditions of mental health and neurodevelopment, they are always going to be this beautiful, chaotic mix of genetics and neurochemistry and brain biology and environment and our early upbringing and our psychology and all of these things together. And that's bloody complicated. But it's also beautiful in a way in terms of, as you say, there is not necessarily one thing that is the blame. And I will definitely go out on a limb and say when it comes to the causes of ADHD and how we currently see the condition and the diagnosis, it is definitely not a matter of blame for something that you yourself have done or that your parents have caused. At least a significant part of how we understand ADHD at the moment is that there are very real kind of changes and differences, however subtle and small, within the brain that we're all on a bit of a spectrum of in terms of how the brain kind of functions and manages things like sustaining focus and actioning tasks and remembering certain things, as example.
Okay, well, with biology in mind, where did the first medications for ADHD come from?
As with a lot of psychiatry, to be honest, there's a little bit of an interesting, dare we say, checkered history somewhat to ADHD and treatments for ADHD. So ADHD treatments come in a lot of different forms. And initially these started as amphetamine-related medications or substances. And interestingly, way back in the 1930s, there was a sense of children being treated for headaches were actually given a form of amphetamine to help with their headaches. But there was this observation that for certain children within the classroom and other settings, when they were on this medication to help their headaches, there was an improvement in their general ability to focus and stick to their work. Maybe even it impacted their behavior, calmed things or improved things somewhat. And that's sort of the starting point almost for where our common concept around ADHD medications and how these drugs and medications sort of work. And since that time, it's sort of developed and progressed from there alongside the actual concept of ADHD as well. Initially, the early concept of ADHD was actually framed something along a moral deficiency for children. So again, if we think about concepts of blame and shame with ADHD, even way back in the 1930s when people were starting to observe that there were certain children who in a classroom setting didn't focus quite as well or might not be sitting in their seat, the fact that the term they used to describe these children involved an aspect of moral kind of or morality or behavior shows that there's always been this dynamic and pull between, is this something just about the children in terms of being good or bad children or their behavior, or is this a condition or a disorder? Is this a mental health condition? And obviously, thankfully, we know now that this has nothing to do with morality or active behavior or choices. This is a condition, but just as the medication has progressed along the years since the 1930s, so has our concept and understanding of ADHD and what the diagnosis actually is and means.
I also think it's pretty remiss of us not to draw the parallels between what we spoke about in our previous episode with a lot of girls with inattentive ADHD feeling as though they did have issues with morality, you know, feeling as though they were not polite, that they weren't kind, that they were bratty, and that they were off with the fairies and that they were disinterested.
Yep.
I don't think that our understandings have evolved as much as I would like for them to. I know that's getting a lot better, particularly in the last 10 to 15 years, but not that historic.
Yeah, and I mean, let's face it as well, as with other areas of medicine, and, you know, I know our good friend Dr. Izzy, in terms of women's health, is so on point with this, but in all areas of medicine, mental health and psychiatry included, traditionally women have unfortunately been sort of left far behind often in concepts of understanding kind of health and well-being and illness and things. And so I think when it comes to ADHD and girls and ADHD and women, that's absolutely the case, and we're kind of only just starting to catch up now and recognize things for what they are.
How about that old wives' tale? I know that a lot of people listening to this will be familiar with it. It kind of used to be thought of that if you wanted to test whether you had ADHD, or if you wanted to test your child of whether they had ADHD, you'd give them a stimulant medication and you'd see what happened. And if they went crazy or they kind of seemed like they were on speed, they didn't have ADHD. But if they were able to focus, oh, well, then they must have the condition. Why is that a load of shit?
I was going to say, absolutely not medically approved in terms of any sense of that.
I don't know where it came from. It wasn't until this year that I learned that that was rubbish.
Yeah, we definitely know that's not the case with stimulants or any other kind of medication. And I still even have adults now presenting with this a sense of, well, can we just try the medication and see? And if it helps me, then I must have ADHD. And if, you know, I think somewhat unfortunately things are a lot more complex than that. And, you know, even people who might not have ADHD might notice some subjective sort of sense of benefit and differences from the medication, and vice versa as well. You know, medication and drugs are not sort of going to be a fix all or save all here, and that black and white line of if it helps, it's ADHD, if it doesn't, it's not.
I did hear a friend say, like, yeah, well, I mean, everyone's going to feel good on stimulants. They're stimulants. Like, coffee is a stimulant. You're going to feel good on it if you're an adult who has a stimulant. So it kind of checks out. Can we talk about medication options and the types of people that you see in practice who are wanting to go down a medicinal route? Is it common for people who are diagnosed with ADHD to want medication, or is it like where does it sit on the scale?
It's very variable, obviously. I think there is a lot of talk about medication, and sometimes there can be a sense of pressure around medication being the only option that people feel is available or helpful or potentially there is a treatment to improve ADHD. We can dive into that, but that's absolutely not the case. Medication might be one option of many to sort of help treat and improve ADHD symptoms. Generally, I think people are very just open to all avenues of treatment. And for me as a psychiatrist and a doctor working in this area, that's the key thing. I thank my stars actually that I did a psychology degree before med school, but a sense of medication is not the only route. And there are other really, really important, powerful things we can be doing in day-to-day life on the psychotherapy side of things that can improve ADHD as well. So it's a bit of a mixed bag, but generally people are at least open to it, I think.
I think for me, it brought me a sense of hope. And the idea that perhaps I wasn't going to have to suffer. Suffer seems like too deep of a word. But I was suspicious of the fact that I had ADHD for a really, really long time. And I kind of thought of it like I was able to, have this hyper focus and I was really spontaneous, I used to euphemistically say. And I was a good problem solver. And I was like, no, I've got this under control. And as I got into my later 20s, the burden of it definitely amounted. And it got to the point where I was diagnosed with depression and anxiety years and years and years beforehand. For me, medication options did not work. And what ended up prompting me to go and get a diagnosis was just this feeling of like, well, maybe things could get better. Like maybe you could get some medicinal help and maybe you can find out different ways to change your lifestyle or to change certain things that you're doing to make you not have to suffer in this fog, in this kind of depression for as long as what I had. What are the medicinal options for someone who is, brand new, unmedicated, just been diagnosed? What do those options look like?
There are various options for medication-based treatments for ADHD. I think, again, and I'll probably sound like a really kind of wet blanket doctor to harp on about this, but really important to point out that for a diagnosis of ADHD, there are a whole range of different options. And so actually for a lot of patients, we might start with recommending psychotherapy or psychology-based treatments for ADHD, and especially for more mild to moderate ADHD, or as a starting point for people before medication, that's where a lot of people are actually really motivated to start. And I think that can be a really powerful, and research shows a very, very effective tool. Lifestyle factors, which we can dive into too, things around exercise, diet and regular meals, sleep, all of these things we know also have research, neuroscience-backed evidence for improving ADHD too. So those are vital kind of things to keep in mind. But absolutely, for people whose ADHD is at a level in terms of significance and severity of symptoms and impacts, medication might be one of the things we consider. And there are a range of different options. And I think this is where it can get confusing for people as well. And so just as you said right at the start, Keish, this isn't to kind of, take away the need to be talking to your doctor about medication and to get sort of individual advice. But it is, I think, important to talk about this, because one of the biggest things I see as a psychiatrist online around ADHD is actually a lot of chat about medications and a lot of confusion, a lot of kind of not that evidenced or sound information around ADHD medications. So that's why I'm kind of really passionate to talk about this. So medication options, at least here in Australia, they include a range of different short-acting and long-acting medications, and the primary treatment options for ADHD are what we call stimulant-based medications. And so these are medications that are stimulant-like in terms of they're a chemical or a drug that acts like a stimulant in the brain. And that is to do with what we talked about before, that theory that levels of dopamine and noradrenaline might be slightly lower or out of balance in certain areas of the brain. And so these stimulant-based medications work to increase or alter the levels of dopamine and noradrenaline within the brain too, by a theory, and we're waiting for the research to clearly show us, but improve those levels of neurotransmitters and thus improve symptoms, which is what we see clinically.
So in terms of the short acting versus the long acting, when I was going through this process, I did find it kind of ironic that one of my main symptoms was that I had time blindness and that I was really forgetful. And so speaking with my psychiatrist, I opted for the long acting because I genuinely knew that I would forget to take short acting medication. what would be your reasoning for choosing? Is it kind of like patient choice, or is it more what the doctor thinks will be best in that situation?
Yeah, it's obviously always an individual kind of discussion with the patient and something that the doctor and the patient work out together. Short-acting forms of medication, so for example, short-acting Ritalin or dexamphetamine-based medications, they might last sort of anywhere from 3 to maybe 5 hours. Obviously, everyone's different. And so sometimes the benefit there for people might be flexibility, but obviously, as you say, remembering multiple doses can be difficult. Sometimes a bit of an on-off type effect of short-acting medications isn't that attractive, or obviously that's uncomfortable for people. So it's always just a matter of sort of balancing things out and seeing what's best for the patient, but also what's indicated and safe, obviously medically and psychiatrically. Because the longer-acting forms of certain medications are ones where, we're able to take them once in the morning and then they slow release across the day, and theoretically for most people last sort of quite a significant span of hours, anywhere from sort of 7 to 8 hours to maybe up to 10 to 12 for certain forms of long-acting medication.
What are some of the side effects of either of those two?
So ADHD medications, again, a whole range of potential side effects and impacts. That's not to make people nervous or sweat over there in the other chair,
No, I actually
Kish,
think it's
but
really important to
it's
talk about these
super
things
important.
because if you're experiencing them, I think it can be kind of scary.
100%.
And it can be that type of thing where if you're so scared because of the side effects, you might be inclined to stop treatment at all rather than maybe trying something else or reducing a dosage. So I actually think it's very important to talk about when you know you've had too much.
Absolutely. We
Yeah.
want to, with any area of medicine, especially psychiatry, we want to make sure, it's always a subtle balance. It's always weighing up risks versus benefits. But for stimulant medications for ADHD, there can be some really common initial side effects, especially. And because they're stimulants, people might notice things like their heart rate going up slightly. There might even be an element of kind of jitteriness or even an anxious type feeling initially. And that can sort of persist mildly sometimes for some people. A little bit of tummy upset and initially some mild headaches as well are things that can be commonly part of the body adjusting to a medication and to a stimulant treatment. Other things that can be there can be sort of lowering of appetite or impacts to that to some degree. Often for adults, that's mild. And sometimes because it's a stimulant, there can be impacts on sleep as well. And that might be where choices around, long versus short-acting medications, types of medications, doses, all of these things are really, really complex when it comes to kind of the benefit from the medication versus the side effects and the risks. And it's always something obviously very specific to the patient and worked out between the doctor who's prescribing and the patient.
For anyone who listens to Life Uncut, you know that sleep is my favorite subject. I am sleep obsessed. But the reason for that is actually because it was something that I struggled so badly with for so long. And during my diagnosis process, when we were talking about medication options, that was my number one hesitation. I said, I'm worried because I already struggle so much, not only to fall asleep, but to stay asleep. I wouldn't go as far as saying insomnia because that seems like something only that should be clinically diagnosed. But I had a lot of sleep disturbances that really, really impacted my life. And I was pretty scared to go on a medication option that I thought could exacerbate that or make it worse. For me, I was presented with the option of clonidine, and I actually don't completely know how it works. All I know is that it was given to me as an option to try and alleviate some of my concerns around sleep. So are there options for people like that other than maybe what I'm on? And how does that work?
Yeah, absolutely. There are other medications like clonidine, as just an example, that can be used to assist with symptoms of ADHD or potential impacts and things as well, around sleep or other impacts too. There are also a broad range of medications used for ADHD that aren't stimulant based as well. So there are medications that aren't sort of amphetamine or stimulant related that we still know can improve and assist with ADHD symptoms. And those are very valid options in their own right. If someone might not want to consider stimulants, but also there are considerations that might need to be looked at if there are medical, mental health, or other reasons that mean stimulant medications might not be safe or appropriate or indicated for a patient at any one time. So, and again, I think it's important. Just recently, I've seen some inaccurate, for want of a better word, info online and on social media about some of the risks of medications. And again, this isn't about demonizing or fear mongering with medications or promoting medications, but it is to say that it's so important, especially for me as a doctor working in the media and working in different spaces, to call out what's evidence based. So we do know that stimulants do have some potential significant risks associated with them. A lot of those are around the heart, and so for example, stimulants, as with any form of stimulant, impacting things like our heartbeat or our heart's function. For people generally without any heart conditions or significant family history of heart issues, that risk is thankfully still very, very low, but it's potentially a very serious risk. And so that is why any discussion of medication should always be based on kind of the needs and the person's direct circumstances, but also things like blood tests and an ECG, things getting checked and just checked off to make sure things are safe before and alongside regular medications, also really important.
Something that I've wanted to learn more about are the long-term side effects of taking medication. I try to pick and choose the days that I really feel like I need the medication. I don't know whether that is because I do have this little bit of a fear, that I think logically, well, if you're taking a stimulant-based medication for 40 years, surely that's going to have an impact on your brain long term. But I don't actually know whether that's the case.
It's a really, really common question and common kind of worry and fear. And I think the thing to reassure people on is that there isn't evidence as of yet that taking a regular medication for ADHD is going to clearly, definitely cause direct negative impacts or side effects or long-lasting damage to your brain or other area of your body. But obviously, as with all medications, there are potential sort of impacts over time to medications. So we do know that just keeping an eye on things like blood pressure and heart health, different aspects are really, really important with ongoing and long-term stimulant treatment. But that's, again, why it's a really important sort of thing that these medications aren't taken lightly, and that they're sort of followed with regular follow-up from your doctor and sort of regular medical and general health checks as well.
Let's just say in 20 years, there is some research, and this is very hypothetical, this is not actually evidence-based. Let's say hypothetically in 20 years' time, there is some research that shows that there's a bit of brain deterioration or global brain death or whatever from taking long-term use of stimulant medication. I questioned in myself, would I still take it? And my answer was yes, because I have had so many of my symptoms that I didn't enjoy about ADHD, a lot of my behavioral traits, a lot of my kind of impulsivity and seeking out what I call like dopamine seeking behaviors. They reduced so much to the point that I said, the balance for me, I'm not comparing potential issues long term with nothing. I'm comparing potential long term issues that we don't yet know about and that may not actually come to fruition with quite a debilitating condition and something that I'm going to have to continue living with the burden of if I don't take this medication. So for me, I did weigh up the pros and the cons, and for me, the pros of medication were very clear. But I still do want to consider other things that I can do in my life to mitigate the need, I guess. For me, one of those things was reducing my alcohol intake. Is that common?
Yeah, I mean, everyone's different, obviously, but I think something that we obviously know is involved with alcohol and other substances is sort of that sense of impulse control and urge and things. And while ADHD does not cause, obviously, addiction issues or struggles with substances or vice versa, we do know that people with ADHD are significantly more likely to struggle with alcohol use or substance use. I sort of do hear that from patients a fair bit. And I think, the other angle here is also what I call the flow-on effects from ADHD, which, as we mentioned in sort of the last step, mood struggles, anxiety, different things that can also be pushed and pulled and pinballed from our ADHD symptoms. And something that I see quite a lot is this need to, for want of a better term, self-medicate or, calm our mind, calm our body, reduce anxiety, reduce overwhelm and stress with alcohol or maybe with other substances. I think whether it's from medication, psychology, lifestyle changes, or any other treatment, when ADHD is feeling supported and improved, I think that also has a part to do with less of a need to kind of have something there to maybe quell our mind and body in some other way. So it's definitely something I see, and something, as you say, that's a really, I think, can be a positive kind of flow-on effect to general mental health too.
I relate very, very strongly to that. And I think the lifestyle changes that have been instrumental in me making better decisions that impact my overall well-being and overall mental health. But before we get on to those, I just wanted to ask, there is a lot of criticism about using stimulant-based medication in children. What are your experiences clinically with that? And what are your kind of, I don't know, do you push back on the criticism, or do you think that it's valid?
It's a really complicated area, and I'll definitely start straight off by saying I'm not a child or adolescent psychiatrist. I only sort of see and treat adults, and that's sort of the area of my clinical work and experience. So I'm probably not well versed clinically, especially to know all the ins and outs there. But, you know, when it comes to impacts from medication, potential side effects, potential lasting effects, we do know that there is more to consider there for children and young people compared to adults. And that can even come in the form of stimulant medications, potentially impacting things like appetite and even growth within the body. Again, that's not to, you know, make parents or any young people fearful, because as we said, it's always about balancing these things and the benefits versus the risks. And when prescribed right, monitored right, done safely, we do know that, of course, for so many children and teens, these medications are so vital, game-changing, life-changing, and they don't lead to any necessary sort of negative outcomes physically or with side effects. But, you know, I think that argument around medicating children or not is a really, understandably for good reason, complex one, and it's a very needed one. But again, I think even if it's us talking about this for adults, that's why I think these kind of conversations are so important, and why for parents it's also so important to be, you know, looking at information online and within the media that is actually evidence based as well, because social media and things, for all its blessings, and I love the place as well just as much as other people, but you know, it can be a real melting pot for kind of misinformation and health anxiety and things, especially when it comes to some of those debates around, you know, diagnostic labels for kids and medications for kids.
I know that for a lot of people who are suspicious of the fact that they may have ADHD, maybe the people around them have told them, maybe their GP has even indicated that it might be something they should investigate. The next steps are a bit weird. For me, I was
confusing,
like, yeah,
right?
it's a little bit, you know, like what comes first, the chicken, the egg? Who do I go to? What do I have to do? For me, I was really lucky. My best friend was diagnosed 3 months before me. So I picked up the phone and said, what am I supposed to do?
Where'd you go? Yeah.
What's the first step? What's the final step?
Yeah, really, really important discussion, because it's confusing. There are a lot of different routes. There's public versus private. There's money involved. That, you know, it can be very confusing and overwhelming for a lot of people, and that's a big part of this as well. I think for anyone listening, obviously one of the first and best places to start is, you know, with all of those amazing sort of GP colleagues of mine out there. You know, I think if you are thinking about any kind of concern or question around your mental health, ADHD included, seeing your GP to talk about that is always a really great first port of call. And I think for ADHD assessments, within Australia at least, probably different in different parts of the world, and also even with medication prescriptions and stuff, it can be confusing because different states in Australia have different legislation and laws as well, which we can also touch on if it's helpful. But your GP is a really good place to start in terms of a referral, and it might be that an initial assessment and diagnosis of ADHD can be made via a psychologist. Obviously, a lot of really great clinical psychologists who are really well versed in neurodevelopmental conditions like autism and ADHD, who can provide sort of a diagnostic assessment and a screening and things to guide the presence of a diagnosis. From there, generally for a condition like ADHD, and especially obviously if we're looking at all treatment options like medication, for example, the diagnosis then needs to sort of be made with a psychiatrist to sort of confirm that. And there are lots of different routes for that, as it sounds like you kind of were met with, Keish. But, again, a referral from your GP is probably one of the best places to start. Public psychiatric services, obviously there's some potential there for psychiatrists to be available to diagnose, particularly maybe for kids and younger people. For adults at the moment, generally the private medical world and private psychiatric services are where most of the ADHD kind of assessments and diagnoses are going ahead. And so there are a lot of different places where that can go ahead, and a number of psychiatrists around Australia now doing that in person and via telehealth to make it sort of more accessible for people. For certain places and with certain psychiatrists, it may be a lot of pre-information around screeds sometimes, and patients I've seen will always thank me for this or not, but screeds of psychometric screening tools in terms of questions around symptoms and how you notice them, where, how long, childhood symptoms. There's getting collateral questionnaires done by family members, school reports, piecing all of that together and then having a diagnostic assessment with the psychiatrist, as an example in my case, and that might be done in one long session. It might be broken up into a number of sessions depending on the psychiatrist and the service, but it's sort of moving through that process to get the diagnosis confirmed, and then from there different treatment options like psychology, lifestyle recommendations and changes, and possibly medication are obviously sort of next steps after that.
The financial aspect of a diagnosis, if you go through the private system, it's impactful to a lot of people. And I think that it would be silly for us not to mention the privilege in it. And it's something that I've spent a lot of time thinking about, because I am in a privileged position where I was able to afford completely private care. That actually, this is kind of a funny story. It actually meant that my GP, who is my regular GP, which is a privilege in itself, a lot of people don't have access to the ability to pay the gap between their bulk bill GP and not. And so they are forced to go and see the only bulk bill GP in their area. I am lucky enough that I did have a regular GP. He knew me relatively well, so he was happy to provide me with an open referral to any psychiatrists. But at the time, the average wait time to get in to see a psych was 8 months. And I made a couple calls, and it's pretty typical, I think, of a lot of people with ADHD. I was like, fucking hell, this is going to take forever. And then
wait that long.
Then I was like, well, man, instead of actually just getting myself in the queue, I waited, and I finally found a psychiatrist that would be able to fit me in within 5 months. And by the time I saw him, my referral had expired. So that meant for me going back to my GP, getting another referral and seeing the psychiatrist. And I had a couple of appointments at my psychiatrist. It is a really expensive process.
Yeah.
In addition to that, I got blood tests done, and I also can you explain actually the reasons for the blood test? I'm happy for you to be very honest about it. I know exactly why I had to get blood tests, but what are the clinical reasons?
Yeah, well, I mean, it's important in terms of blood tests when we're presenting with any physical health condition, but also mental health as well. We want to make sure there isn't an overt physiological or biological cause. And so, this is down to everything to do with, vitamin D deficiency, or maybe anemia or severe iron deficiency. Obviously, that can affect things like our ability to concentrate, focus, our energy levels. So blood tests for an ADHD assessment and diagnosis, and then especially medication, are around making sure there is nothing else that's medically physiological that's there causing the symptoms perhaps, but also medical tests around blood tests, and often, depending on the case, an ECG to look at your heart. Those are obviously important parts if potentially going down a medication track is wanting to be looked at too. And that's just to make sure physically things are all okay, and within the body, within the heart, there are no potential risk factors there that would make medications or certain treatments sort of dangerous or not suitable.
For me, I also did a urine test because I think my psychiatrist wanted to dot the I's and cross the T's, and he wanted to make sure I wasn't drug seeking.
Yep.
So I had a drug screen as well, which of course I was clean for.
And I will just say that's really common and standard. I should have mentioned that as well.
I thought that was why I got a blood test. I didn't realize that he actually might have been checking for other potential causes.
100% really important. And as you say, will be different with different psychiatrists, different cases, but just screening to make sure there is nothing else happening that would put you at risk from medications, but also to see whether what you might be noticing with your mental health or physical health might be caused by something physical within the body, or potentially sometimes from substances as well. So it's not a matter of judgment or anything from us psychiatrists, I swear, but it is just about checking that on those medical substance fronts, everything is kind of known and that things are safe to kind of proceed.
And just to set up the expectations for anyone who might be about to undergo this process, look, I felt myself like it was jumping through a lot of hoops, and I understand why. That it's not a criticism. I very much understand the reason that that is the case. But I want to prepare you psychologically that it can feel a little bit like hurdle upon hurdle, and the waiting time can be tough. It can be it can just take a little bit of energy going through and talking and filling out all. I mean, again, this will be different for each psychiatrist. For mine, I had to fill out a lot of paperwork. A lot of paperwork. I think he's streamlined it a little more now.
I get patients saying, is this a weird test for
I thought it was a
if
test.
you can finish the questionnaires, do you not have ADHD? I get that all the time.
I genuinely thought they must have some type of tracker in the back end.
To
And they
see
must be able to
how-
see how many times I've had to come. I had to go 20, it would have been about 20 times. I had to go back and forth, back and forth. For me,
It's cruel.
But I do get it. But yeah, it was very mentally consuming. I just want to set you up knowing that that is potentially what you will be going through.
And please, from the doctor's side, from the doctor's chair, I will say that if it feels like there's a lot of paperwork, a lot of hoops, you're not just seeing someone for 15 minutes and sort of being told, yep, think you've got ADHD, let's start some medication. I hear you. It's grueling and cruel, and when we're coming for struggles with focus, to be made to do all that is so ironically hard, but it's actually a good sign. And these are conditions that are really complex and can be caused by a lot of other potential mental health conditions, even physical health conditions. So the hoop and hurdle jumping is, I hear you, it's a lot, but it's also because these are complicated conditions where there's a lot to try and work out. And for adults who are being diagnosed with ADHD, as we said in that first step, Keish, the key with ADHD diagnosis for adults is that there are clear symptoms there from early on and across your life. So there's a lot to kind of consider and work through, and that's why there's a lot of hoops and paperwork often, but also there often might be more than one session to sort of see a psychologist and then a psychiatrist, or the psychiatrist multiple times. And again, in my eyes, I think that's always benefiting the patient, obviously, if things are just really thorough and clear. And anyone that's seen me will know that I'm probably a stickler for being a perfectionist and not wanting to leave anything out or stones unturned. But, that's hopefully because it's in the interest of the patient. I do want to touch as well, Kish, on the finances side of things, because you mentioned that before, and I think it's really important. And I'm a private psychiatrist, and so I absolutely hear that I am, for want of a better word, I'm in the system. But as a private psychiatrist, I want to point out as well how important it is to say that I think that's one massive area in Australia where things do need to change, because as you say, there is a huge gap here in terms of the finances for assessments and treatments, which are often very high. As we said, they're really complicated assessments and a lot goes in there, so I'm not going to try and justify any finances at all. That's not what we're here for. But I do agree in terms of access to care, access to affordable care, even access to public services for not just ADHD, but mental health in general. I'm definitely going to get on my bandwagon here, even as a private psychiatrist, and say, I absolutely hear people when there's a sense that this is actually quite hard to access, can be very expensive. And that is something that, needs to change within Australia.
I completely agree with you. The very last thing that I did want to mention for anyone going through the diagnostic process, with the questionnaires and everything that you're asked, something that I needed to be reminded of, and that's the only reason that I'm mentioning it to you, is to answer everything honestly, because you actually want help for what you're experiencing.
Yeah.
I think I accidentally fell into the trap of doing what I thought they wanted from me, which is a little bit symptomatic of having the condition for 29 years before being diagnosed. And I thought, what are they going to want to hear from? Oh, well, I won't mention that because they won't care about that. I realized I needed to drop that. I needed to drop the wall and just actually answer every single thing truthfully, because if it wasn't ADHD, I wanted to know what it was. And I wanted to know whether there was actually help for me that could alleviate what I was experiencing.
Yes.
So
Yeah.
this whole diagnosis process for me has been the most life-changing thing I have ever been through. It has alleviated so many negative criticisms that I have given myself over the course of time. It has brought this whole new vitality to the way that I live life. And for me, medication was a big, big factor in that. I think it was a large part of what made me feel like the cloud lifted, quite literally. I can feel the difference when I'm able to focus in a way that some other people are just lucky enough to naturally be. So thank you so much for all of your expertise and your wisdom. I know I've kept you here for so long, and for you guys, it's a
Trust
Friday
me.
night that we're recording this on because Kieran worked today.
I could rant about this all day. So no, the pleasure's mine. And I think, we're wrapping and stuff. Keisha and I won't ramble and keep you here all night as well. But I want to thank you so much for bringing that point up as well, and obviously for your just openness and vulnerability and everything here with your journey with it, because it's important. It's important for people to hear not only this information from me, kind of quacking this out as a doctor, but also from people who have been through it. And I will say as well, and just second, that it is really, really important to go through the process and the assessment and the questionnaires with open eyes and an open mind as well, because I loved what you said there around it's about kind of figuring out what's going on, and that may very well be ADHD, but it's also important to know that other conditions that we've talked about already, anxiety, depression, trauma, these things can also impact things to do with our focus, our memory, our impulsivity as well. And I just want people to know that if, we're going through an assessment and it's not ADHD, that's the outcome, it's important to know that whatever the outcome is in the diagnosis that might be there, there's a sense that these things are so valid, they're so worthy, you are valid in experiencing them and wanting help for them. And if the answer is an ADHD, it's hopefully going to be the case that the answer is something that can also be supported and treated and improved just as much. And so that's really, really vital to the whole discussion here as well. But thank you so much for having me, and it's just been an absolute pleasure. And like I say, I love to rant and ramble, but especially when it's about what I do day to day for my job. So thank you so much for having me.
Thank you.